Welcome to Empowered. I'm Elizabeth Namofsky. Today, we're tackling a condition that affects millions of women, but often goes undiscussed: irritable bowel syndrome, or IBS. For some, the symptoms seem to strike out of nowhere. For others, the warning signs build gradually over time. So, why do so many women describe feeling 6 months pregnant after a meal? And what's really going on in the gut? Joining me today is Dr. Rahima Hirji, a leading naturopathic doctor with a focus on digestive health, to break down what IBS is, why it affects women differently, and help us better understand and manage this complex condition. She's the co founder of the Tummy Clinic and the founder of Sage Naturopathic Clinic, with 4 locations in the Greater Toronto Area. Dr. Rahima, thank you so much for coming again, or not again. Thank you so much for seeing me
But
again. How
hopefully
are
this
you?
weekend. I'm good. I'm good. Yeah.
Uh, okay, let's just dive right into this. What exactly is IBS, and what isn't it?
So IBS is a chronic condition where the gut is oversensitive. And what happens is that there's a miscommunication between the brain and the gut. And so often symptoms will include things like bloating, constipation, diarrhea, gas, or all of it together, and also some pain. Now, what it isn't is inflammatory bowel disease like Crohn's and colitis. It's not colon cancer, and it's not celiac disease. So on a scan or on a scope, you're not going to see it. That's why it's also often referred to functional GI disease. But the symptoms are nonetheless very, very real.
So, why does it take the average person years to get a proper IBS diagnosis?
So there's a couple of reasons. One is that there is no test for IBS. So that makes it very difficult. And not all practitioners are familiar with it's called the Rome criteria, and it's a criteria used to diagnose IBS. So often patients bounce around, especially women. They're dismissed as, it's just stress or it's just hormones. And so it takes a long time before they get the proper diagnosis. And there's also the piece where sometimes you're embarrassed, right? You don't want to talk about what's happening. And so it takes some time before people feel comfortable even bringing it up with their practitioners.
So, for someone who's struggling, is IBS something that develops suddenly, or are there warning signs along the way that people should look out for?
So it really depends. Like sometimes there can be a trigger. Like it can be, after food poisoning or after an extreme level of stress or trauma, people might remember, oh, after this, I never felt well. And in other cases, it's something that's been kind of there. Maybe it's there when you were younger. You remember having some butterflies in your stomach, and then as you get older and your stress increases, it becomes, more and more prevalent and becomes very disruptive to your life.
So, is IBS really all in your head, or is there something else going on there?
Oh, it's absolutely not all in your head. So the because it's a functional GI disease and because you can't see it, often it's, oh, it's all in your head. But we have a lot of research that shows that these patients experience more pain than the average person. So it's that gut sensitivity. We also see changes in motility. So in some patients, the motility is increased for diarrhea or decreased in constipation. And also, we see that the gut bacteria or the microbiome is changed in these patients. So there are changes that are very well researched in these patients. So even though, again, you can't see it, it is very, very real, and the symptoms are very, very real.
So, let's talk about stress, because everyone's stress level has risen recently. How does stress and your gut, like, how does that work with the brain access, and does that actually affect your digestion?
Yes, 100%. So you can think of it as, your gut and your brain, they're on the same group chat, right? So all the messages coming in, they're both getting them. So the problem is when your brain gets stressed, it goes into fight or flight mode, then the body stops sending resources, stops, sending blood and other things to the digestive tract and really focuses on dealing with the stress at hand. And so what ends up happening is that there can be inflammation that comes from that, which can lead to like gut hyperpermeability. Again, you can see that sensitivity of the gut increasing. And the stress also has an impact on your bacteria, again, leading to an imbalanced microbiome.
So don't go away. We'll be right back with more IBS, what to do, and how to handle it.